Good afternoon, ma. Today we are going to see about the anatomy and physiology of the angle structures. Okay. So angle. The importance of angle is process of aqueous drainage. Angle means anything between two surfaces. Here it is between the cornea and the surface of the iris. So in between this, that is from the root of the iris, we have anteriorly ciliary body. In front of that we have scleral spur. And in front we have trabecular meshwork and the Schwalbe's line marking the anterior limit of this angle. Okay, clinically, how we are going to see this? We are using gonioscopic examination. We cannot see this using direct lamp examination. So we are going to use specialized lens that help us to see this angle. That is the gonioscopic examination. Okay. So this is the angle structure. As you can see here, from the cornea between the root of the iris, we have this angle. So in front of the root of the iris, it is the ciliary body band which is the forming first, and in front of that we have a scleral spur which is a prominence of the sclera, and then we have this trabecular meshwork, and in front of this we have this Schwalbe's line. Okay. This is how it looks in gonioscopic. So here this is the corneal layer and this is the iris layer. So in the root, in this root of the iris, we have the ciliary body band, and in front of that we have a thin whitish line, that is the scleral spur, and above that we have a pigmentation. So it is this pigmentation which helps us to identify this trabecular meshwork. So it is a pigmented trabecular meshwork, and above that we can see the scleral Schwalbe's line, which marks the corneal limit, anterior limit of this angle. So this is how all the structures are seen in the gonioscopic examination. So not only by seeing we are going to grade them. In that, the most common used is Shaffers grading. There are other grading like Ski's grading system and all present. The common used is Shaffers. So if while seeing in gonioscopic examination, if we can see up to ciliary body as we saw in the previous picture, then it is the wide open angle. If we can see only up to scleral spur, then it is open angle and it is grade 3. If only trabecular measure, only the pigmented line is visible, then it is narrow angle, that is grade 2. If the Schwalbe's line is only visible, that is a thin line, only the corneal limit of that structure is seen, then it is extremely narrow angle, that is grade 1. If no structure is visible, just opposition of cornea and iris is just seen, then it is closed angle. Okay. So there are 4 grading in Shaffers grading system. Going to see about individual things, Schwalbe's line. So Schwalbe's line is the anterior limit. So how we are going to see, it is the termination of the Descemet's membrane, which is seen as a fine scalloped border. Okay. If any pigments are going to deposited in this Schwalbe's line, which occurs in case of pigmentary glaucoma and pseudo exfoliation syndrome, then that is called as Sampulosi line. Okay. Trabecular meshwork. So meshwork means it is the sieve-like structures which is made up of connective tissue and trabeculocytes. These trabeculocytes, they have the contractile and phagocytic properties. So they form this trabecular meshwork. The importance is for the drainage of the aqueous humor. And how does it look? It looks in triangular in shape. So with triangle, the apex is towards the Schwalbe's line and base is towards the ciliary body. What we saw there is trabecular meshwork we identified using the pigmentation. But at birth, the pigmentation will not be there, and the pigmentation develops with the age. So we are dividing this morphologically into 3 types. One is uveal meshwork, then the other corneoscleral meshwork, and juxtacanalicular meshwork. As you can see here, from the ciliary muscle root of the iris, that is the uveal tissue, there is a meshwork which is extending. Then that is called as uveal meshwork. Then behind the uveal meshwork, there is a extension from the scleral spur up to the lateral border of the scleral spur. That is the corneoscleral meshwork. That is between the sclera and the cornea, that is corneoscleral meshwork. And above that we have a very small area which is bridging this trabecular meshwork, which is covering this trabecular meshwork area, that is juxtacanalicular meshwork. So uveal meshwork, corneoscleral meshwork, juxtacanalicular meshwork. These three will form the proper trabecular meshwork. Okay. Scleral spur. So scleral spur is nothing but it's a translucent strip of sclera. It appears prominent white on the gonioscopy, but how it looks is it looks like a wedge-shaped circular ridge. Okay. Ciliary body band. Ciliary body band, as we saw, it is the posterior most part of the angle. It represents the anterior face of ciliary body between its attachment to scleral spur and insertion of iris. So the width depends on the level of insertion of the iris. It is wide in case of myopes and narrow in case of hypermetropes. It is a dark brown band. Why do we need to see the anterior chamber angle? It is because we need to see whether it is an open angle glaucoma or closed angle glaucoma. That is for classifying the glaucoma and to assess the angle recession. Okay, and also to note the extent of neovascularization. In case of neovascular glaucoma, we need to see up to which level the neovascularization has proceeded. And also for planning the treatment in case of iris neovascularization and other laser procedures, and for PA and all, we need to plan the treatment. So we need to have an idea about the angle of the patient. Aqueous outflow. So as we know, the aqueous humor which is produced from the posterior chamber drains via the pupillary opening to enter into the anterior chamber, and from the anterior chamber the drainage occurs at this angle which is between the cornea and the iris. On the angle here, the trabecular meshwork will take up via the Schlemm canal. It is drained into the episcleral vein and the drainage will occur. Okay. So it includes trabecular meshwork, Schlemm canal, collector channel, aqueous veins and episcleral veins. Okay. Once again, the trabecular meshwork, the component is uveal meshwork that extends from the root of iris ciliary body band, and behind that from the scleral spur there is another meshwork, that is the corneoscleral meshwork, and behind that it's the juxtacanaliculaar meshwork. Okay, this juxtacanaliculaar meshwork will bridge the Schlemm canal. So uveal meshwork. Uveal meshwork is the innermost part of the trabecular meshwork. As we saw, it extends from the iris root to the Schwalbe's line. So it is arranged in a form to create some openings, and it inserts anteriorly to the Schwalbe's line and posteriorly to the ciliary body. Gonioscleral meshwork. It is the middle portion. It extends from the scleral spur to the lateral wall of scleral surface. So here they have some elliptical openings, and these openings are not aligned. So what happens is the aqueous will follow a circuitous route to reach the Schlemm canal. Okay. Then juxtacanaliculaar meshwork. It is the outermost portion of the trabecular meshwork. It is the narrowest part. It just covers the Schlemm canal. In this, the juxtacanalicular cell will have some cytoplasmic processes. This process attach externally to the inner wall of endothelium of the Schlemm canal, and internally it attaches to the corneoscleral meshwork cells. So it offers some natural resistance to the aqueous outflow. So it is the juxtacanalicular meshwork that is offering some resistance to aqueous outflow. As you can see, the juxtacanalicular cell cytoplasmic process has extension. The extension attaches to Schlemm canal endothelium on one side and to the trabecular lamellae on the other side. Schlemm canal. So it is the canal. Canal is the oval channel. It is present circumferentially in the scleral surface. So in this, the canal is lined by endothelium, which is the irregular spindle-shaped cells having the walls. So this canal has the aqueous walls that prevents the backflow, that helps in uniform flow. The outer wall of the canal, we have smooth flat cells, and they contain the opening of collector channels. So these collector channels are also called the intrascleral aqueous vessels. There are many in number, 25 to 35 in number. They leave from the Schlemm canal to terminate into the episcleral veins. So they are just like a bridge between the Schlemm canal and the episcleral veins. Okay. So drainage, on the overall drainage, we can see the aqueous humor from the posterior chamber enter the anterior chamber via the pupil. Just again some physiological resistance, and from there it is drained out by one is trabecular outflow and the other we have the scleral outflow. So from the anterior chamber, the drainage via the trabecular meshwork into the Schlemm canal, collector channel and episcleral vein. This constitutes the trabecular outflow, which is the major part of the outflow system, sound-based segment. And some amount of aqueous will drain into the ciliary body, and via the suprachoroidal space they enter into the venous circulation. This constitutes the uveoscleral outflow. Trabecular meshwork, it is the main drainage system. 70 to 80% is drained, but uveal scleral outflow constitutes 30% of drainage. So the aqueous will pass across the ciliary body between the bundle of ciliary muscle into the suprachoroidal space and is drained via the venous circulation of ciliary body, choroid and sclera. This suprachoroidal drainage constitutes the uveal scleral outflow. That's it.